I want to talk a little bit about what stress is, because I think the word stress means different things to different people. And I'm not somebody who believes or agrees with the use of the term positive stress or good stress. I think really, if you look at the dictionary definition of stress, it is to do with a state of mental and emotional strain or tension resulting from adverse or demanding circumstances. Now, adverse and demanding circumstances can be challenging, and challenge can bring about growth. And I think challenge is a very healthy and a very good thing. I think when most people talk about stress, we're really talking about reaching the threshold of our ability to cope, and really finding that we don't have the resources to manage multiple stressors, or the level of stress that we're trying to live and cope with. So I think we need to be quite careful about how we do talk to people about stress, and understanding that when we're talking to someone else, we may have a slightly different meaning to the word stress. So for me, stress is beyond challenge. So long as we meet increased challenge with an increased capacity to be resourced, to find new resources, and to meet that challenge, then that is healthy. The problem occurs when we have a lack of resources, or we're in a situation where we cannot find the resources, and then something very different happens. When we're in a state of being challenged, we can be in a state of flow. And being in a state of flow means that we can, manage multiple things. We're not adversely affected by what's going on. You may have heard the expression, it brings the best out of us. Stress is overwhelming. Stress is very damaging when we find that we can't cope, and we therefore need to adopt other strategies to cope. And this is when we end up with disease and illness. So there are two main contributing factors to that. One is that we are trying to sustain stressful things for a long period of time, and we literally don't have the physical, mental, emotional resources to do that. The other is that we're managing multiple stressors. Now, people in normal circumstances, if that exists, but the average person without severe trauma and adverse experiences in their past may find multiple stressors and multiple plate spinning and things to manage stressful in itself, and also working with things over a prolonged period of time. When you add into that mix somebody that is in a state of hypervigilance or a state of fight flight because their stressors mean something different to them, then we're talking about how stress can develop illness and disease. So there is a very distinct difference between the symptoms and really the triggers and what causes disease. So what we tend to experience is the physical, mental, emotional, and the social results of being under stress, of not having the resources. And those resources can be time, patience, money, knowledge. It can be any number of things, and it will be different for the situation and different for the person. But whatever it is we feel we're lacking, we get kind of driven to cope in a different way, and it becomes about our survival. So the symptoms that we get are usually what people try to address, and those symptoms obviously show up different in different people depending on what those triggers that trigger people to change and behave differently, and what those root causes are. Now, this is a very simplified version because our root cause of the way we manage stress and what predisposes us to manage stress are very, very individual. They are to do with everything from our birth experience, what we learn in infancy, trauma, lots of different things, lots of different factors that add up to what predisposes us to be able to manage or not manage stress. Because of what we've learned to be safe or not safe, some people may be in a more heightened state of hypervigilance. So imagine then coping with long-term stressors, managing complex family issues, complicated work situations, and kind of over a long period of time that is drawing on your resources. Or many multiple stressors, but trying to do that in a heightened state of hypervigilance. Try to do that with carrying the results of severe trauma or traumatic experiences. We are designed and geared for survival, and the first thing we have to do before we can do anything else is to survive. So if I've learned here that certain things, that certain look from a certain person means something, it means danger to me, whatever the meaning I have given to something because of my past experiences now sets me with different triggers to other people. And our triggers are all very individual, and some people have many more triggers because of their experiences than other people. So these people become predisposed to the way in which they handle normal everyday stressors or multiple stressors or stressors over a long period of time, because it may not be safe for them to manage them in another way. They may not have the resources, the knowledge, the experience, the support. They may not be able to manage their situation in a way that makes it safe for them. So they're in a heightened state of fight flight, or they may actually be in a freeze response. What that means is they are unable to cope with what we might consider to be normal everyday stressors. To them, it's like adding the last little bucket onto the buckaroo. It's the last thing that means they can't cope, and they can't cope physically, mentally, emotionally, and of course we end up with social situations where groups of people are trying to manage their stressors, but of course are finding it very difficult because they're very triggerable based on what they learned. And these learnings come from experiences, from our family values, from our cultural values, our religious values. So when we feel a challenge to these learnings and to these initial core beliefs, that is when we become triggered. And then when we're triggered, we end up with the symptoms. So I don't think it's enough to do things like just meditation or just coping in the moment, because I may help to cope with what has triggered me. What is just as important is to also work with what I am holding underneath that has taught me that certain situations are safe or not safe, so that I can actually begin to not be triggered and not be running hypervigilant programs and programs that are running underneath, so that my everyday life of coping becomes much more difficult. So different people have different coping strategies, but we all have a general health threshold. And if we're carrying too many multiple stressors or too many past events and past experiences that we've not been able to process, then we get this build up of a deficit really of energy and of resources to cope with stressful events. So really with conscious health practice, what we do is we work backwards from our symptoms, and we look at what must be triggering us into the symptoms and where those learnings come from, what caused us in the first place to be responsive to those specific triggers. So I think really for me the key message from this short video is be aware of what stress means to you. Do you know when you're stressed, and do you know what triggers you? If you find it difficult to manage multiple stressors, or you're finding one particular long-term stressful situation becoming too much for you, what is it that is missing for you that would help you to deal with that? Because the stress really means that you're not in a resourceful place. It could be because you're in fight flight, or it could be because you just have something missing from your armory of resources at the moment. So we talk in conscious health practice about the 6 key elements for change and the 6 areas that need to be fulfilled in order for you to be able to safely change and be able to cope with stress. So what is your understanding of stress, and how do you experience stress?